at 1513 Hutchinson Avenue, Knoxville 37917.
That's right. Well, nothing makes someone look better than a great smile. Now, here on Style, we've done our fair share of teeth makeovers at Dr. Foncea's office. Done a great job. Now, using techniques like zoom whitening or veneers.
Those techniques can really make a difference for anyone, but how do you know which one you need? And we're going to talk a little bit about that with Dr. Pablo Foncea with Sequoia Dental Arts. Now, Dr. Foncea, we've talked a lot about whitening. You've been on the show talking about whitening. Today, are we talking about, is it veneers that we want to talk about?
Well, yes, that's the new kind of buzzword that a lot of people are talking about. They even have brand name veneers that you see on these extreme makeover TV shows that they're
so veneers, what are we talking about? Veneers, are these fake teeth? What a veneer is a what?
Well, let me describe it in two ways. If you are a woman, you might want to describe it as kind of like fake nails. It's something that you use your normal shape, you adjust it a little bit, and then you apply a thin layer over that to recreate the shape and color of the tooth that you want, and even change the position of them.
Okay.
So you can do some like orthodontic type looking work. I mean,
yes,
you could fill in gaps, things like that.
There's even a catchphrase now that's being also used. It's called instant orthodontics.
Okay.
And the difference is most of the time these people could be candidates for braces, but for some reason they're deciding either, no, I'm not going to ever do braces again. My kid did that, and I'm not going to do that.
Right.
Or sometimes even after braces, there's going to be a need for some veneers after that because of the shape of the tooth or the excessive wear. Something that
it's not
happens.
exactly what you want to look like.
Right.
Okay. And how long will a veneer last? How long do they last?
The studies now are going on to 20 years.
20 years.
Now, it doesn't mean everybody's going to get 20 years. I would look at 10 to 20 years as a reasonable range. Realistically, it depends on how excessive you wear your teeth.
Like, do you chew on ice and all those bad
Bite your
things?
nails.
Those other bad habits, exactly.
Okay. Now, once you glue it on, can you feel? I mean, does it? You just get used to it? It's just...
Yeah, it's so thin. It's between 0.3 millimeters. I mean, that's very, very thin,
right,
to 1.5 millimeters at the most. And that really creates a very natural effect, a very natural look, and your lips get very used to it. It's no problem at all.
Do you have to do the whole, mouth, or can you do certain teeth? Or
each case is individual.
Okay.
We have a lot of cases where we combine it, where we do tooth whitening first. Say the majority of the mouth is actually very healthy and looks good, and maybe just the front 4 teeth have spaces or gaps, and then maybe we just veneer the 4. Otherwise, if they're looking to recreate the entire smile, then you really want to look at their whole smile while they're looking, even from the side, because you want to make sure you get everything.
And we have some pictures here of some before and afters, and
this lady is missing 2 teeth actually on the left side up there. And what we did is we whitened everything but the top, and then we put new veneers to recreate a shape and kind of moved her midline over to a more natural symmetry there.
What's the thing? They look so real.
Yeah, they do.
Really, I'm sure that's...
Like right up into the gum line. Some of the old crowns that have the dark, like the metal look there, can you cover that with a veneer and have it look more natural?
Yes, you can. Now, there's a few cases where you can actually put a veneer over an old crown. It has to be an extreme... maybe it's connected to a very long bridge and you don't want to replace the whole bridge. There's sometimes the best thing though is to just replace it with a new crown or a new porcelain veneer.
Okay.
How about bleaching? As far as, you have whitening and you have veneers. What is bleaching compared to all these other ones?
Well, bleaching is great for people who already have teeth who are in the right position and actually look correct. It's just they're not bright enough. So bleaching is so simple. That's what most people end up doing first. And then what we'll even have is some people where they'll bleach a whole bunch, come back, and just replace the 1 or 2 things that need to be touched up afterwards.
Some little things here and there. Yeah. Okay, now sometimes you have patients who need a combination, like a lady we featured back in November who truly needed some help, and she really had a lot of work done. I know as well. I think we have some... we have some video. Yeah, here we were working on her, and then she had some serious problems and overbite and many different things. Now you did a little bit of everything with Robin, right?
What we ended up doing with her is we started with the veneers. Well, you kind of plan the whole case at the beginning. You have to have a complete evaluation, and in that way you can prescribe which order things need to be done in. In her case, we ended up using porcelain veneers, porcelain crowns for the teeth that were more damaged, and then bridges for teeth that were missing, and replacing those. So it was really a combination of things. And then a lot of times we'll end up doing whitening as well. And you can do whitening beforehand and then just keep that maintained afterwards. And then your new veneers will match the color.
Definitely a case-by-case basis. Some
Definitely.
people need a lot more, and
Absolutely.
some people can use just a little bit.
Yeah, it sounds like
Yeah.
there's some art involved in it too. I mean,
Well, it's a lot of fun. If you use a very good lab, then you can get teeth like you saw up there that just blend and really look more natural, as opposed to just looking like a solid opaque white
right.
mass up there.
Right.
It's you know, it depends on the labs you use. You got to be careful.
That's the big thing. You want them to look real. Thanks so much
Yep.
for coming on.
Thank
Well, thank
you
you
We
very much.
appreciate
Thanks
it
for having me.
as always. And